Hi. During our first episode, we talked about the 4 P's. I really want to focus on the first P, which is prayers. This doesn't mean you have to be religious. I'm not pushing religion on anybody, but the most important thing is to be positive and have some sort of faith. If we're not a positive person and we're trying to help our loved one, whether it be a mother, father, grandmother, aunt, uncle, wife, or husband, there's virtually no chance of creating a quality of life for your loved one. Why is prayer or faith so important? The positive disposition will give them a higher likelihood of healing. It also creates a good mood when you're working with the caregivers and creating an environment that's very positive. Positive reinforcement is very important, particularly when you're raising children, but it becomes equally important when you're taking care of an elderly person who's homebound or bedbound. These are really essential. I've noticed with my patient I take care of, when there's a negative disposition or negative environment, it doesn't mean necessarily that there has to be no religion in the home. It becomes much harder to heal the wound. There's just kind of this negative aura in the house or apartment, which makes it impossible for everyone to succeed. The family, the caregiver, the patient. So if we're all holding hands, it doesn't have to be a big kumbaya where you're praying like you're in synagogue, in church, or some other house of worship. Just having a general sense of faith and embracing each other and creating a really positive environment with a lot of optimism and potential. If you have any questions or comments below, please feel free to leave them, and make sure you subscribe to the channel, and I look forward to our next episode. Thank you.